Thank you so much for joining Lecturio's webinar today. My name is Dr. Satria Syaban. I've been invited by Lecturio to share some of my experience, both as a student, as somebody who used to consult on medical education related matters, and as a doctor on what sorts of tips and tricks you can use in the coming semester as you prepare yourself to go back to school. Right. So which profile describes you best? Are you a pre-health, medical student, nursing, PANP, non-student, or other? Perfect. So I think we can move on. And I'm going to go to the next poll now. How familiar are you with Lecturio? So as this is an event held and organized by Lecturio, the Lecturio team would like to know whether or not you've used Lecturio before, just so that they have an understanding of your familiarity with the platform and whether or not you've used it so far in your studies. Okay, perfect. And while I move through this the slide deck, feel free to put it in the chat whether or not you've been at one of the other Lecturio events, be it for teachers or for students. So yeah, sit back and enjoy the materials that we have for you in the next hour or so. Right, so speaker's introduction. My name is Satria Syaban. I am a medical doctor from Indonesia, a general practitioner, and I'm currently a master's in public health candidate with the Erasmus Mundus Joint Master's Degree Program. And I've done my first year in Dublin, Ireland, and I'm currently doing my second year in France, specializing in epidemiology and biostatistics. And I've worked with Lecturio before as a medical education consultant, where I essentially help them apply the platform on different scenarios within medical school, nursing school, healthcare education, and provide suggestions on how they can best fit into the educational platform based on the latest research in medical education and healthcare education. So today we have three different things that we're going to cover. The first one being time management techniques. Why is it important in healthcare education, and how you can do that effectively. The second one will be some evidence-based learning techniques. Obviously, there are plenty, but we're going to touch on some of the basic ones that you can readily apply in your daily learning activities as soon as today. We will also share a sort of framework, a proposed step of a worksheet if you may, and it's something that would help you guide and structure the way you prepare your learning, so that you're able to quantify and understand better what types of things work for you and what types of things do not work for you. And there's a message from the Lecturio team here. To get the Lecturio Premium, there's a 50% off using the code STUDY50, and you can use this code at checkout and get a 50% discount before you come back to school. And I definitely urge you to try it out. I've used it myself before when I was in medical school, and I found that it has been really helpful to, give me a chance to review at my own time, to practice. Great. Okay, so I'm going to now talk about the material. The first one being time management. Setting yourself up for success. So time management, by definition, is the intentional organizational process that provides individuals with a structure that allows them to have enough time to complete tasks while having the flexibility to adjust to changing conditions. And, this is particularly important in medical school and healthcare education in general, because a lot of the times with the advent and the inclusion of remote learning, asynchronous learning, as well as the higher importance that is placed on self-directed learning at this level of your education, You may feel a sort of disconnect from your community and educators. You may struggle to choose the right techniques, the right style of learning, and end up relying on ineffective study methods and having difficulty finding good content, the right content to supplement your learning activities. And the limited time available for you to study, combined with the increased amount of medical knowledge, of healthcare knowledge, as the days go by, makes it nearly impossible for you to take in everything and still balance it with the right, with your personal life. And so, we're coming here to the fabled work-life balance. Is it achievable as a healthcare student? And time management and the work-life balance is not only important as a concept on its own, but in relation to stress as well. Stress is an umbrella term that describes a force contrary to the body's homeostasis. I'm sure that every one of you have learned this in class as well, and it can be both psychological or biological in nature. And stress, especially those at higher levels, may lead to changes in neurotransmitter levels and hormonal levels, many of which also affect your ability to learn and your ability to retain the knowledge that you've learned. There is a curve that's often used in sporting and in management called the Yerkes-Dodson law. While it has some detractors out there, I personally believe that the concept itself is sound. It essentially states that humans perform best between a certain level of stress. So too much stress and you'll not be able to learn to perform properly. Too little stress and you're not going to be motivated enough. And stress doesn't have to mean, um, that that psychological stress. Again, as I said, it's going to also be biological. It can also be you challenging yourself. It can also be a level of difficulty, a level of challenge in your educational journey that pushes you to do better. And when utilized properly and harnessed properly, pressure and challenges may, in fact, improve performance and learning when it falls within the growth and learning zone. So how can we manage time and harness stress properly? There are 5 things that I'm going to share with you today, and as well as those evidence-based techniques and the framework that I want you to try using yourself at home. But we'll start with the simple ones first. So first one being better to-do list. So here you see a to-do list that is, unorganized, unclear, without a clear deadline, without a clear order, scribbled. And I personally wouldn't be able to follow this effectively because there's no way for me to tell whether or not these things are completed. I'm not prioritizing it well enough, and it will end up messing up with my time management. And so a good way to start in order to manage your time better is to learn how to make good to-do lists. For every person out there, there's going to be a style that fits them. Some people like to make really detailed to-do lists. Some people like to make bullet journals. You can find your own way, but for me, this is an example of what works for me is to make sure that it's ordered properly, that it's ordered in based on the priority. And I'm going to show one prioritization matrix that you can use to order your priorities. And it's spelled out properly with clear goals as well. In making those to-do lists, it's important for you to understand the layout of the things you have to learn, the things that you have to do, so that you'll be able to prioritize things. Here on the left, you see the Eisenhower Decision Matrix, which distributes tasks and things that you have to do in a particular time period into 4: important and urgent, important and not urgent, not important and urgent, as well as not important and not urgent. And these 4 different squares, 4 different quadrants, essentially should help you understand better which tasks need to be done now, which tasks can be done later, and which tasks can be delegated or can be put off till later, or can be combined, can be done with other people, so that it doesn't take up too much of your effort. But all of them follow the same logic. categorizing them based on importance and urgency. Why would this be useful? Because this can help you manage the stress of high workload. And in medical education and healthcare education, this is something that a lot of people, especially when you come in from high school, from college, can be overwhelming. So sitting down every morning or every evening and listing down the things that you need to do and prioritizing them based on their urgency and importance is a great step to manage that stress and therefore put you in the zone, so to speak, that will help you optimize your learning. It can reduce distraction and anxiety in facing your to-do list. It can push you to collaborate and delegate tasks to coworkers and friends and help you always finish the most important things first. Now, a simple poll that I want you to try and answer, shouldn't take more than 15 seconds. Of the four quadrants that I've outlined just now, which one do you think deserves the highest level of time investment and energy investment? Okay, I'm seeing 13 answer here. 36, 63, a couple more. Would love to have more answers here. Mm-hmm. 60%. Those who haven't answered, we'd appreciate your response as well. Once we hit 70%, I will reveal the answer. Okay, Grant. So I will reveal the answer now based on what is out there, with the theory that is out there. The thing that you should actually invest most of your energy in is actually the things that are important but not urgent. In an optimal environment where you have planned properly and you have learned how to set good objectives, set good to-dos, set good prioritization of your tasks, the most important ones are the ones that are not urgent, the ones that allow time for you to think about it, allow time for you to invest the amount of energy and forethought that it deserves. If everything is important and urgent, that means that there's something in your time management, there's something in your prioritization that is not the best, because that means that everything is due tomorrow or everything is due in 2 days. Where, again, if you practice time management properly, most of the things, especially the most important ones, will fall within the important and not urgent things, because you've already planned them properly, have them on a timeline, and will be able to invest the right amount of effort that it deserves, so that you get the most out of it and that you retain it for a longer period of time. Okay, the next one is reducing distractions. Now, this is something that I think a lot of you must have already practiced. It sounds very simple, but to me, it's something that I often forget. For myself personally, a lot of the times the state of my room is reflective of how much anxiety, how much stress I'm under. And in a vicious circle, when my space isn't tidy, isn't clean, isn't, devoid of distractions, when I study, I get distracted very easily. So I think a good first step is to make sure that you have a separate area, a separate space for you to study, to do your homework, to do your tasks, to do your academic writing that is free of distraction. And part of the things that you can do that by is through bringing only necessary materials to your area, use the time management capabilities built into your devices, for example, locking Instagram or locking all of those other social media tools after a couple of hours, after a set amount of time. Keep your phone in another room or turn it off until you finish your allotted amount of studying. Block out unwanted background noise with headphones, noise canceling headphones or earmuffs, or use techniques such as the Pomodoro techniques to block your days or block your study sessions into focus and rest periods, which has been proven as well to improve productivity and improve the quality of your focus when you are in that zone. So reducing distraction sounds simple, but it's something that a lot of people often forget. Lastly is to set personal goals. I think I also talked about setting to-dos, and this is really related to that. To-dos, prioritization, reducing distraction, and setting personal goals. I may set it as like 4 different hacks, but it's actually 4 interconnected things. It's very important for you to set up study goals that are smart in nature. And I'll come in a second and explain what SMART means, because it helps you manage your priorities better and lets you clearly how much time and how much effort and what a completed task looks like. And that's something that a lot of people often forget to do. They just set this loose, either too ambitious or um, or goals that underestimate them, and setting them out or spelling them out in a smart way is definitely something that can help you avoid those pitfalls. So I'm going to give you an example here, setting an academic goal. And this sample is for a student doing their obstetrics and gynecology rotation. They're in the middle of it right now. And so a good SMART goal would read something like this: finish reading the OBGYN chapter on the first trimester pathologies by 8 p.m. tonight, right? And SMART means specific, measurable, achievable, relevant, and time-bound. Specific means that the task is clearly defined, what is to be read, and the subject matter of the task is mentioned and easily understandable. It is measurable. The task is complete when you finish reading that chapter on the first trimester pathology by 8 p.m. So it's very clear when it's complete. It is achievable. It's not that difficult to read a couple, some 10 pages, some 20 pages on first trimester pathology before your rotation or before your case presentation the next day. So it is definitely achievable. It is not too ambitious. And you yourself are the one who can best qualify whether or not a goal is achievable or not. That's why practicing and learning how to set SMART goals is an important step in time management. It is relevant because you are in the middle of your obstetrics and gynecology rotation, and tomorrow's class or tomorrow's discussion is about the first trimester pathology. And it is time bound because it is clear that you have to finish this by 8 p.m. tonight so that you can either do or move on to other tasks on your to-do list. Right. I see there's an interesting question here about listening to music while studying. And I think that this is an interesting question that is essentially up to what you prefer, up to what you experience yourself. For example, for me, I am unable to study with music. I can study with white noise or things that do not have patterns that my brain recognizes, essentially, that helps drown out distractions from the outside or help provide a background to my learning period. Some people would suggest setting the same music or associating a particular tune with studying, which would help you move into that focused focused state that helps you learn better. But, if you're a person who can listen to music and absorb knowledge effectively, feel free to do so. But remember that, it may be challenging for your brain or for yourself to process 2 sources of information at the same time. So, try out different types of music, try out different types of sounds, but my suggestion would be make the focus reducing the distraction. And if music helps you do that and gets you in that zone, then feel free to do so. All right. The second part of this session is evidence-based learning. It is very related to time management as well, because as I've mentioned in the beginning, one of the main problems that a healthcare student feels over the course of their studies is that they don't know what sort of techniques to use. They may lean on techniques that their seniors tell them are effective, or techniques that they used during a different level of their education that they found to be useful. But again, medical school, nursing school, PA school, healthcare education is very demanding. There's a lot more information that is coming in and a lot less time. So you need to make sure that you're not using the same technique that used to work for you, that is actually not that effective. And this is where I'm coming in right now, to show you some evidence-based learning techniques that educational literature has said is important for you, for optimizing knowledge retention and knowledge absorption. So in one of the sessions that I've had in the past, I did a little poll with the attendees of the event where I asked, how are the large hall lectures of your institution delivered? And we found that, you know, most of them said that there were medium levels of interactivity. Again, almost many of them said that there were no interactivity, and only 3% of them said it was fully interactive. And when asked us another question about how feedback was given after exams, a lot of students responded that they were only given feedback as scores, only given in rare cases, only for formative exams, and only 18% of them said that it was consistently provided. And, you know, this is an example of the differences that medical schools and healthcare schools have around the world, and how important it is for students to sort of have a good basic uh, on their own on how to learn and how to manage their own self-directed learning over the next 5-6 years, or even more if you're going to go into residency afterwards, because schools vary in quality, but if you have a good basis in yourself on how to learn, and use the right evidence-based techniques, you can have a baseline level of guarantee that your learning is going to be as optimal as the situation permits. So I've been talking about evidence-based learning a bit just now, and I'm going to talk to you now about what it is. So evidence-based techniques are a class of approaches, processes, and strategies that have been empirically demonstrated to produce learning outcomes. We are taught that evidence-based medicine in healthcare education, we're taught evidence-based medicine with an increasingly evidence-based approach. But are we also doing the same thing for our personal learning? And I'm gonna, have a quick feel of the room here with the next poll, and feel free to answer with the option that represents you the most, represents how you feel about the situation the most. Are we also using the right evidence-based techniques for our learning? Are we also approaching the act of learning as we are being taught medicine? There's 34% of you answering so far, 40%, hoping to hear from some more people. But I'm seeing that here the trend is that most of you are saying no. And I personally agree with you. For a lot of us, we are not, there's no bridge from high school to college to medical school, that allows, that prepares us for this influx of information, that prepares us on how to manage our own self-learning, or our own learning better in a self-directed manner. And so it's important for you to use the types of techniques that I'm going to cover in the next couple of slides. So the first example, so obviously there are a lot of evidence-based techniques out there. Books, there are many books out there that shares or cover these techniques, and Lecturio, I think, has had articles and student webinars before that cover a lot of these techniques, but because of the limited time that we have today, I'm just going to cover around 3 or 4 of them. So the first one being space practice. So space practice is the act of distributing your study sessions, or study of a concept across multiple sessions separated by a period of time. The goal is essentially to provide time for you to consolidate the information and not cram it all in the end. Even though that would work for tests, cramming in the literature has been shown to not be good for long-term retention. And as future healthcare providers, long-term retention is definitely something that you want to have for the knowledge that you learn over the course of your studies. So space practice can be something that is helpful for you to do as a medical student, as a student, healthcare student in general. So how does it look like in real life? So here you see there are two terms, there are two abbreviations, ISI, interstudy interval, and retention interval. And interstudy interval is the interval between study sessions, and retention interval is the study between the last study sessions before an exam testing period. So essentially a space practice means that you do not cram. It's the opposite of cramming, or cramming, for those who don't know, is the act of studying a huge amount of information close to a test, meaning that, instead of having these multiple study sessions, they just have one study sessions very close with a very short retention interval between that study session and the exam or testing period. And while some studies have shown that they performed comparably, people who do spaced learning, who study 6 months, 4 months prior to a testing event, and those who study very close, say 1 week or even 3 days before a study event, when tested again after a period of time, it is consistent that those who do space practice can retain things longer. And so what I'm suggesting here right now is to start scheduling your learning. Use your planner, use your to-do lists, and understand your academic schedule so you understand when each testing event is and when your classes are, so that you can plan when to study, how much to study, and what sort of distance will you give between one session and the other. And the second one is retrieval practice. Retrieval practice is the act of calling information to mind rather than rereading it, or simply rereading it, or simply hearing it, which produces an effort from within to induce better retention. So as its name signifies, retrieval practice is essentially you retrieving the knowledge again after learning it for the first time, or actively sort of pulling the knowledge as opposed to just absorbing it passively. Wait, before I move on, sorry, I see a very related question here from Alessandro. Studying a topic on day 1 and brushing it up on day 3 is spaced learning. Yes, that is a version of spaced learning, but you don't have to study sort of everything on day 1 and then review everything on day 3. What I mean is that have a continuity in place, study a portion of it, a manageable portion of it, set some time apart, and then study it again, continue it again in the next couple of, after a couple of days, which would force you sort of to form links between those information, right? Because if you're studying things that are connected, that is separated by the time, or has a temporal distance, you'll be forced to look back again, review again, form these linkages from these frameworks in your mind on that topic. And if you continue doing this over multiple different sessions, these links, these reviews forms stronger neural connections, making it far easier for you to pull these knowledge back from your long-term memory to your short-term memory, and making it easier for you to use them when you need them, either in a test situation or when diagnosing a patient. And there was also a question about planners. So there are plenty of planners. I myself combine paper and technology, so things like Evernote. Lecturio has its study planners, which would allow you to see the workload, how much workload you have based on the videos and tasks that you've assigned to yourself, that your teachers have assigned to you. I use paper myself, so I have a bullet journal that I write on, that with an academic calendar tied inside it. So I put in where my tests will be, and I sort of make a schedule of when each topic needs reviewing, or which topics need to be studied upon. So yeah, I think that was a good question. Wait, what would you advise when you have clinical rotations and still need to read the theories to get all the knowledge? I think for Mugabe, before I move on to retrieval practice, this is a very good question. Actually, let me answer that at the end, because that's a more of a overall question, rather than a space practice question. I'm going to move on now to retrieval practice. Retrieval practice, again, is the act of calling information to mind, actively learning it. And what I mean by that is essentially doing these things that you see on screen. So this QBank, again, these are examples for Lecturio, but there are a number of QBank out there. Many of your schools would have question banks or would have practice tests that are available to students, past papers that you can download and practice upon, or even open source quizzes. Anki, flashcards, they have questions that people have put there that you can use to practice. And what I mean by retrieval practice is testing yourself, filling or quizzing yourself on certain things makes it so that you need effort to remember something. You force your brain to recall something, or when you can't answer it, you're pushed or you're forced to look into resources to be able to answer those. And those acts of actively pulling information, actively retrieving information, is far more efficient for knowledge transfer and knowledge retention than simply passively absorbing things. So rereading something once or reading something else without testing yourself on them. So yeah, that's what retrieval practice means. And that's something that you should consider putting into your study session. So not just reading, but ensuring that your study session also incorporates practices, either from quizzes, either from peer learnings, quizzing each other using flashcards, or taking question bank tests, which would allow you to evaluate yourself at a higher level of understanding, because they usually come with case questions, clinical vignettes, making it so that you have to think or put yourself in the mind of a practitioner. The third concept that I wanted to share with you is interleaving. And I see a good question from Devis here that I'll answer after the interleaving. Interleaving is the act of mixing different but related subjects or topics when learning. And you see here, topic A, topic B, C, and D. The example on the first row is what we know as blocking, which means that you learn only one concept, only one thing at a time, and then move on to another topic, and then move on to another topic, so that one study session is focused on something, only something, either a particular topic, a particular diagnosis, etc., etc. But mixing up related concepts in one study sessions, for example, mixing anatomy with a bit of physiology where related, mixing it as well with the right pharmacology, is called interleaving, and it has been shown in the literature to be much more efficient. And so here you see two types of ECG strips, so two different versions of what blocked practice and interleaving practice looks like. In the blocked practice, the student is given the same type of ECG strips, ECG readings, with the same type of diagnosis. And while they have higher perceived mastery, when compared with people who in one practice session is given ECG strips covering different types of cardiological pathologies, the people in the interleave practice group have better diagnostic accuracy in a statistically significant, with a statistically significant difference. And so in the field of healthcare, where, our oath essentially makes us or ensures that we make all the effort we can to give the best care to our patient, no matter how small the effect size is, it is your duty to sort of practice the best thing possible for you to retain the better knowledge, retain things better, and learn things better. And so interleaving is something that you can try and incorporate into your study sessions. So what I'm saying here, essentially, before moving to elaboration, is that I want you to keep in mind as well the parts that I've talked about before. So time management, to-do lists, prioritization, and then mixing it with scheduling, scheduling your studies, structuring your study session. All of these techniques can work on their own, but they are best when they are combined with each other to form a continuum that works best for yourself. Now, elaboration is the fourth tip that I wanted to share with you. And before we move on to the concrete framework, quote unquote, that we've prepared for you today. Elaboration is a learning strategy involving the learner's enhancement of information, which can be implemented by means of an inference, image, comparison, illustration, or overall summary. It's essentially the act of asking, how is this happening? Why is this happening? So understanding the process behind something, understanding the reason behind an illness, a symptom, a condition, as opposed to just memorizing the right treatment for this condition. Understanding why the treatments work would help you learn and retain what you've learned better than simply memorizing that drug A works for disease B. And in real life, it would essentially look like this. So say there's a patient with severe COVID-19, and one of the main things, main presenting symptoms or vital signs that we see in severe COVID patient is that the patient would present with hypoxia, which is low blood oxygen saturation and often severe respiratory acidosis. Like in a rote memorization situation, that's it. You see that you remember that, oh yeah, a patient with severe COVID would have hypoxia, and so I should give them oxygen. But elaborating it, so understanding how or why, will make sure that you'll never forget that a severe COVID patient presents with hypoxia, would be best treated with this level of oxygen, this, how many liters of oxygen, with which type of mask, what type of other supportive treatments, because you understand the pathophysiology behind it. So, this happens because of an increased dead space due to endothelial inflammation, increased diffusion barrier, as well as a right-left shunt formation due to atelectasis in some cases, not all. But what this does to you, answering how and why, is it helps you refine your schemas, the understanding schemas that you have in your brain, and helps you retain these things better. And that's why, that's also why retrieval practice works. That's why testing yourself on a particular topic works, because it forces you to remember what was the reason that this was the right answer. And when combined with feedback, when you have a question that you answered right or wrong, and you're given feedback why you're right, why you're wrong, this will help you remember the mistakes or the correct answers that you've given far better than just finding out your score, So yeah, perfect. And before we go to our proposed steps, I'll look at the chat and see what questions we have right now. So let's see. Flashcards, retain information I learned. So there are some questions that I think I've already answered. Like, how do I retain information I learn? Flashcards can be useful, yes. As I mentioned before, flashcard is a form of retrieval practice. So you have greater effort when you try to remember something actively instead of just you quiz yourself on it, essentially, with flashcards. When combined with peer learning, it can be even more interesting. Answering flashcards that you didn't make yourself will essentially keep you safe from that, the trick of mine where you think you remember what the answer was when you were writing the flashcards. So combining your study schedules with group sessions, peer learning, tutoring is something that you should also consider. Do you suggest taking digital notes or physical notes with paper pen for better understanding or clarity? Now, some people, again, this one for me is a matter of preference as well. I think in the era of iPads, it's the difference gets smaller and smaller. So I personally take notes on my tablet, and it's worked as good for me as it did on paper, because the essentially the act of writing, the act of actively committing something to a medium helps you subconsciously or consciously review the knowledge, or process the knowledge that you're hearing, process the knowledge that you're learning, and put it in your own words, to be put into that other medium of yours, be it a paper, or a digital tablet. And while there is some evidence, some people say that writing is much better than just typing. I personally think that it's all about preference as well, because some people can learn just as well by typing. Some people do the same mental gymnastic that people who write on paper need when they type. So again, it's up to you. It's up to what makes you feel comfortable. But yeah, maybe start with paper, the classics. If it doesn't work, if you find that you can't write too, your writing speed is too slow, try and use a computer and see if that works. Color coding is great. What planner would you recommend? I answered that already. Clinical rotation, and you still need to read for the theories and get all the knowledge. I think this is about your academic calendar structure, and it's something that you definitely need to discuss with your teachers, because essentially before clinical rotation, somebody should already have a basic amount of knowledge that would prepare them to perform their duties in that clinical rotation. Or at the very least, the clinical rotation would begin with some reviews, some classes, before you're asked to do anything, which is called in education scaffolding. So the proper level of information is given for a student before they practice. So it's definitely worth it, I think, to talk to your educators if you feel like you're not being prepared adequately before a clinical rotation. Yeah, that's the best answer I can give here, I think. What would you do for the test when the lecturers tend to set random assessment tests? I'm going to do this for one more minute and then go to the last section, which is the frameworks. The random assessment test often is what we call a formative exams. Formative exams are more for the educators to understand your level of understanding than for them to grade you on certain things. So I think, clarify with them whether these random assessment tests are graded or are they, for practice. And even if they are graded, I think for most people, this is definitely weighed differently than a final exam. And so you should take this opportunity to do your best and then ask for feedback afterwards. And as we've discussed before, all of these things can combine to make a better learning experience for you if you know how to use it properly and if you know how to build from these types of feedback and practice sessions. Okay, so I'm going to move on now to the proposed steps framework to take home. So there's going to be a pop-up that the Lecturio will have in Demio, I think. Am I seeing it popping up right now? That you can download the worksheet, a worksheet that we've prepared for you. And it's essentially an easy way to structure your thoughts when approaching a new subject. And yeah, I myself am opening it right now. Give me a second. Yeah, and there are roughly four steps in this process that you can use as a loose guide to learn about how you can study better. The first one being identifying learning goals, and then secondly, understanding your current situation. Third, reflecting on your past or current learning projects, and fourth, reflecting on the outcomes of your learning process. Yeah, so the worksheet is structured in a way that makes it easy for you to use when you first come into a course, a block, a module, or anything, and help guide you to not only reflect on your current situation, but also your experiences studying about things in the past, and kind of walks you through the process of reviewing or introspecting which parts of your study process has been good for you, which parts have worked, have not worked, and helps ask you guiding questions to help you choose the right techniques to study with. So it's also consistent with the a certain change management frame or change model framework, where we help guide you, or this worksheet should help guide you to identify the gaps between where you want to be in terms of your studying and where you're at the moment, and help you walk through the process and identify the steps needed to rectify that gap. And so, yeah, as you can see here, if you're opening it up in your own personal devices right now, we ask you to see what your personal goals are. Remember the SMART goals: specific, measurable, achievable, relevant, and time bound. And understand the course learning outcomes. This is something that a lot of people often forget. Your teachers share their learning objectives at the contract lecture, the first lecture of every module, for a reason. It's for you to understand what they want you to be able to do, or what they've set as the goal of their instruction. And so you as a learner would benefit from understanding what these goals are and keeping them in mind, so that as you go through the lessons, as you go through the module, as you go through your learning, it becomes easier for you to anchor the knowledge that you've learned to these particular outcomes. And we help you by giving you a space here to review that. And then identifying your current situation. So again, looking back at your goal, you can look at your situation right now. So what things am I missing? Which of the learning objectives have I not, am I weak in? Which of my goals have I not met? Or which goals in the past have I failed to met using my current studying technique? And then in terms of the course learning outcome, mark the ones that you feel like you're going to have trouble doing, which ones you have not been able to fulfill, et cetera, et cetera. And then reflect on your learning process. We incorporated several different techniques here for you to review your techniques in, your study techniques in. So considering whether you're scheduling your learning properly. Are you giving yourself breaks between your study sessions? Are you mixing the different topics? Are you prioritizing the things that are related to the learning outcomes? Are you actually just memorizing things that are esoteric and are not things that have been decided as learning outcomes of your course? Are you incorporating any retrieval actions? Are you testing yourself, quizzing yourself? Are you, collaborating with your peers to learn a certain topic? Elaborative actions, meaning that are you asking how or why? Are you understanding the reasoning behind why certain symptoms appear in certain diseases, why certain medications are appropriate for treating certain illnesses? If you didn't, this will remind you to do that. Did you do mind maps to do this? Did you sort of vulgarize these knowledge for yourself? And are you using the right learning medium? And last one is the reflecting on the outcomes of your learning process. So, maybe after a couple of days, after a couple of weeks, as you go into the module, step 4 can be interesting to engage in. Are you meeting your goals with your current learning techniques? Do you still have any gaps? Compare it with your previous module as well. Am I meeting my goals better in this current rotation? If it's not working, why is it not working? Which aspect am I not considering? And I think these sorts of guided inquiry will help you, or will be useful for you to structure your thought process and help you design the best possible scheduling and studying technique for you to optimize your time in medical school, optimize your learning, and make sure that you eventually can reach that fabled work-life balance. And lastly, in the step 5, I did not include it in the sheet, but the step 5, to every time you use this worksheet, is for you to set improvement goals, incremental or otherwise. It's important for you to set SMART goals for you to address the gaps that you've identified with this guided inquiry, and then meet those goals at the with the deadline, with the time frame that you've decided for yourself, so that you can continuously improve yourself with regards to your learning. Okay, so what to remember from this session? Essentially, what the main message that I'm trying to share with you here is that learning in healthcare is challenging. Never make anyone make you think that it's not challenging. And each year is a new challenge, because as you go forward in your learning, be it within medical school, nursing school, PA school, or within residency, within postgraduate trainings, there will be a new situation, there will be a new challenge that you'll need to adapt yourself to. So don't be afraid to make mistakes, and acknowledge that this is challenging. Second, adaptability and being effective is key to having a balanced and fulfilling learning experience. So being able to adapt to a changing learning objectives, changing amounts of information, etc., is key to having a good work-life balance. Third one is that these tips can and should be adapted to your needs. So don't take, this slide deck as Bible or as your blueprint. Take them as a rough guideline, and use them to design your own learning, your own strategy, design your own formula for things that work for you. And it's going to be a trial and error, but you have 5.5 years, 6 years for you to do this. So you have time, but don't take too much time as well, because you should be able to, you should figure this out as soon as possible. When in doubt, remember the principles of being structured, being organized, being clear about your goals and about your intentions, prioritizing things, and being evidence-based in your learning. Okay, and yeah, so I think that's the end of my material. In the last couple of minutes, there are some additional messages that the Lecturio team have asked me to deliver to you. And before then, I am going to just answer some final questions first. So I see there was a question on reviewing QBanks. What is the best way to review QBanks? So most QBanks, including Lecturios, come with a tutor mode or a feedback mode. It's very important for you to review these, essentially understand the reasons behind your mistakes, even the reasons behind the correct answers that you've given. And it's important to reflect on your performance reports after each of these QBank tests to understand which areas you're weak in. These numbers that these QBank platforms give you, they're not just for decorations. It's important for you to use them to identify the areas that you're weak in and target them so that you can learn more efficiently. What would you advise to do if you fall behind with the content in medical school? I'd say, again, be structured, but also don't panic. Identify what you're missing, and then sort of build a plan within a plan. Build a study plan within your existing study plan so that you can catch up on those materials without neglecting the things that you still have to learn for your current rotations, for example, or for current module. So the same principles stand. Make to-dos, prioritize, and be adaptable. One last question before I cover the message that they asked me to deliver is, how early do you recommend finishing the syllabus and starting exam preparation? So this is an interesting question with a very open-ended answer. It's important for you to consult not only with your peers, but also with your predecessors, so your seniors, so to speak, or people in the year above you, or even with your teachers, to understand what have worked for them, what pitfalls should you avoid in preparing for this particular exam. There's no hard and fast rule about when you have to complete the entire thing and start practicing for tests, and different people absorb information differently. But I think the key thing is It's more about what not to do. So what not to do is not to leave it until 3 days before a test. What not to do is to cram everything the night before a test. But everything else sort of, needs a bit of trial and error, needs a bit of asking around, consulting, communicating, and discussing for you to figure out what is best. So I think that's the best I can do to answer this question at the moment. Lecturio, which is the platform that's organizing this webinar, covers the entire medical and nursing curriculum in all key learning formats. So we have high-end videos, recall questions, thousands of clinical case questions, of vignette questions, and thousands of concept pages, which would allow you to learn not only in video format, but also in written format. They also have an application that would allow you to benefit from all the functionalities that they have anytime, anywhere, even offline. And reminding you again that there is a back to school promo where you can get a 50% off for all premium plans in Lecturio, both medical and nursing, using the code study50. Yeah, and there are some documentation, some survival guides, some cheat sheets that you can download or benefit from if you become a part of Lecturio. But that essentially marks the end of our webinar. Thank you for coming. I've been very honored to be your host. My name is Satria Syaban, and thank you for attending. Thank you for the Lecturio team for organizing this as well. It's been a pleasure, and hope that this has been useful for you all as well. Feel free to contact the email if you have any queries about the slides, recordings, or any questions that you may want them to convey to me.